neurologist. If you say you have a backache, they go to the orthopedician. So a physician, a good physician is
probably
because then over-diagnosis will not take place and over-treatment will not take place. For example,
what exactly do you mean
by over-diagnosis? For example, you are having some migraine or some form of headache, and immediately the doctor asks for an MRI scan. Immediately. That's happening day in and day out. We don't want to name names, do anything. You may find a benign cyst sitting somewhere in the brain. It's not doing anything to you.
Okay.
It is not anything. And when you see that, you have to report it.
Obviously.
And then that's when
then
you cannot say, you have to tell the patient 99.9% it is okay, nothing's only a cyst. If a headache, we have treated you for, we have found nothing, there's nothing in the brain to cause your headache, but we have found a cyst. This is over-diagnosis. Why do you want to diagnose the cyst?
Which may not be the reason for the headache at all.
And also, you'll have to tell them the statistics. You have to say, will this turn malignant, madam? That is the next question.
Which scares the patient.
Which scares the patient. And for example, you want to X-ray the lungs. And then they ask for CT abdomens also for this thing. And you'll find all sorts of, as you grow older, you get cysts in certain areas, cortical areas, which the area is cortical, in the kidney, vital organs, kidney, or adrenals, we should not take too much into account. Only if it is significant medically, we should do this. So over-diagnosis, multiple diagnosis, just labeling a person that he is a diabetic case, you are only a patient inside. After that, you are a person. Everybody has some problem or the other. But over-diagnosis is very dangerous because we will be treating unnecessary things.
Doctor, may I ask you a question now? Yeah. So, the first step for anybody would be to go to their family doctor.
Family physician.
Family physician. I mean,
and
a family
go to
physician.
An adult physician.
Adult physician. Before going on to the specialist.
Adult general physician.
Adult general physician before going on to a specialist.
Correct. I think that would be a good thing.
If
way
you
to go.
don't do that, then it can.
Unless of course it is very severe, you are taken in an ambulance.
In which case the physician will refer you to the specialist.
So have I made it a little clearer for you?
Yes, very clear.
And the over treatment again, I don't have to say things to you, but giving just because a person is diabetic, in diabetes itself, there are so many variants. One is adult onset diabetes, that is the type 1 diabetes. 2 is the type 1, type 1 is a juvenile diabetes, the one that comes in children, where the pancreas is infected by the Coxsackie thing and it gets immune. It's
They don't produce, the beta cells.
Beta cells are not produced. That is in children, they have to take insulin, their life depends on insulin. Type 2 is adult onset diabetes.
That's
No. Then before that there are many diabetic diagnoses called MODY, maturity onset diabetes mellitus, there are some chromosomal defects in each of these. So it's called MODY 1, MODY 2, MODY 3. It's more for research in developed countries where they have all the lab facilities and they have the money and infrastructure, they don't have to pay for anything. If we do all those things here, each one will cost 1 lakh rupees, each test, to say if you are a MODY. If you are diabetic, the treatment is the same.
Okay.
So, it is very important. And it is also very important first, as a doctor, I feel as a physician and diabetologist, and after training under Professor CVK, I feel that we have to see the patient, know the patient, encourage them to lead a healthy lifestyle. When a person comes with very high sugars, not to immediately scare them and start them off on medicines immediately.
Is it true
if you have the experience, of course it can. Of course it can. But it's a combination thing. Have this thing to talk about all these things, address it, see if there's infection, family history. Don't treat it immediately with medicines. Lifestyle changes. Maybe first diet, give them a proper diet. dietitians,
Yes,
we diet counsel them, and once you should have. It's a wrong notion that you cannot have fruits, you cannot have things, and people just they think that they can cheat by not taking for those 3 days before the test. That doesn't work that way, because we can do a test, another test, and we find out whether they've been the 3 months test.
Basically diet and
So
exercise.
and pranayama, some sunlight therapy, and walking. And when you do walking 1 hour, make sure you're doing your knee exercises and back strengthening, because when you're walking, all the weight is on your knee. So you'll start developing. I can tell, everybody can tell, walk 1 hour, walk 1 hour. In Chennai, I'm very it's difficult to say to go to a park to a lady, because it's one is getting a good park to go. 2 is it safe? 3 is, can you cross the road and come out alive? So if you go to the gym, don't use cross trainers and things like that.
Okay.
Recommended cycling with back support, walking in very low resistance for half an hour, for half an hour. How you would walk in a walk? How would you walk in a walk? Always warm up, always do stretches, always do knee strengthening. So this for 3 months, and then come back with your sugars, and you should have the gumption to say that, the confidence to say that. And many times you find sugars are beautifully. If I give you 3 things, sugar 3 மாசத்துல குறைக்கணுமா, 3 வாரத்துல குறைக்கணுமா, 3 நாள்ல குறைக்கணுமா, நீங்க என்ன சொல்லுவீங்க?
3 days.
Serious சொல்லுங்க, 3 days. Absolutely fail ninga, because that means there's so much of osmotic changes in the body. Very high, it will go very low. Intensive therapy, it will go very low. So it should be 3 months, slow and steady. Imagine if it is 300, suddenly it dropped to 100.
So that's
bad. So 3 months.
So it should be a steady process.
Exactly.
And one thing
and don't get very this thing if you start losing weight in diabetes. You may be losing it for the wrong reasons, because very high sugars for a long time is catabolic. That means it burns fat. So you will start losing weight, and you don't want the fat to appear in the urine. You don't want to wait till then.
Yes.
So these are all the things.
So the diabetic has to be treated as a person, and not just as a diabetic.
Any disease, if you
Any
take
disease,
it,
yes, correct.
Ma'am, any disease if you take it,
Yes,
you should
correct.
treat it as a thing. So over treatment does not come into the play at all. And giving
Which
the
is
start
what you said,
cholesterol marker,
suddenly bringing
anti-cholesterol,
200.
and anti-cholesterol, don't give all these things. There's so much of statistics for you. You can base it here about statins and their effect in kidneys, about renal failure. Rosuvastatin is one of the forerunners, which has been actually discontinued by the US FDA. Yeah. And these are the other ones which can cause very severe renal damage and muscle damage. People with statins complaining of muscle pain, you should immediately withdraw the statin.
Okay.
Should not be given at all, because I think next to biguanide, which is another type of anti-diabetic drug, which can cause very severe side effects in many people, statins are the next serious things.
Which can cause severe
We should look at all the things in the patient. Is the patient does he or she have other risk factors?
Okay.
Do they independently, because if you ask them diabetes is so
Therefore,
everything headache la irundha kaal vali ellame diabetes dhaan. So it is not that. I think it's important to say let sugar be a friendly passenger and not your enemy. That's very important.
That's nice.
Doctor, I was intrigued by this chart.
Yeah.
Because somehow,
We are
given to understand this HbA1c.
Correct.
So
It's glycosylated hemoglobin. That's called glycosylated hemoglobin, because hemoglobin is glycosylated in a machine, and the 3-month average is given. This is also done by another test, because nowadays HbA1c people are not finding it that this thing. They do this test called serum fructosamine, which is the same thing which is released, which also will give you a 3-month average, and is done more in antenatal cases.
No, I was perplexed by this figure of 8%
yes,
to 9%.
9%, yes.
It seems pretty high.
Very important. I'll tell you why. Below this, in a hallmark study in Lancet, intensive lowering of the HbA1c resulted in 40% mortality. Because low sugar, you don't treat the HbA1c, you treat the person.
Yes.
And hypoglycemia can occur in elders in a silent manner. In diabetics itself, other medical problems, for example, heart attacks, anything else, urinary infections, everything can be silent. So, in fact, there is, if you can just PubMed it, go to PubMed info or Google it. They have Lancet, which is a very, very reputable medical journal, has in the front page news it has said that we have waged the war and won against HbA1c, but you have lost the war against diabetes because they have lost the patients.
Okay.
By lowering the HbA1c.
So, very strict control is also not advised. That is what.
Not very strict. What
I'm trying to say is it should
don't
not lead
go
to
by figures all the time.
And it should not lead to hypoglycemia. Hypoglycemia is a very
Hypoglycemia can occur in normal glycemic people as well.
Yes, but we are
as you
not-
say, don't overdo the work.
Overdo, yes.
Make sure you do your stretching,
what you
make do your knee
overnight,
strengthening,
overnight.
everything. Yes.
Okay.
Okay.
Thank you.
Right. Anything else? Anybody would? Dr. Shobana, Dr. Shobana, tell about statins.
Please tell us the side effects of statins.
Aspirin increases stroke.
Yes, yes.
Could you tell us
In
about the side
aspirin is
effects?
something that we pop in from time to time.
Time to time. But that's why we must not use the aspirin as regular. Some people, some doctors give the aspirin when the diabetes has come to the patient. We diagnose the aspirin, immediately they give the aspirin without any indications. That's all the things are over treatment.
That all comes under over medication.
If it is only required, we have to give aspirin, because aspirin also having the effect of causing the cerebral bleed.
Oh, okay.
So there it will be a
That's
side
why
effect.
it increases.
So the patients have to be told about all the side effects, and only when necessary you
Yeah.
prescribe the.
Only if it is
If it
necessary.
is essential,
only
you
have-
prescribe the drug.
We can't prescribe the medicines thinking that it will be happy.
Yeah.
Only if it
Only
is
when it is essential, really
essential
essential.
only we have to give. That's the main thing. That's also
So,
like
in this hospital, you've
Yeah.
projected these cases.
These are the cases we
This
have.
is the incidental and the overdiagnosis and the
What
overtreatment.
is chart?
Really, I
This
think
chart
two of
is
these charts. Really
20
not
randomly selected cases. You can actually go through it if you have the eyesight to see the cases that have been for the OT and the
Where you
overdiagnosis.
have reduced
Found out,
the
yes, reduce the number of
number of
medications
medications.
and reduce the number of diagnoses as well.
Okay.
Yes.
When you reduce the number of treatments, see, with anything, any disease, no medicine should be abruptly stopped.
Oh.
Correct.
Everything should be tapered. They should be stopped slowly. Give a day, alternate days, then every 2 days. Because if you stop it suddenly, the system will go into it is easy.
So no
it's very
extremities.
important.
No extremities.
Yes.
No extremities.
We have to taper
So
and
thank you very much.
Welcome.
Thank you.
Welcome. Right. Hello.
Hello.
Hi there. This is the you must be wondering what this machine is. And this is the biomagnetic non-invasive pulsar and BM pulsar. It all started, the history of this BM pulsar is very fascinating actually. It was first founded by Professor Glenn Gordon, who was a NASA physicist, and he discovered this gadget. He invented it, in fact, for astronauts who had sudden cardiac arrest in space, and this would shock them. So you need something,
So
isn't
it
it?
was a cardiac.
It was a cardiac
Cardiac, okay.
originally. He's from Canada,
Oh.
and it so happened that he's developed in his old, even in his 70s or 60s, he developed cardiac problems, and his cardiac status was very poor, so he was admitted in the hospital. He had a cardiac attack, myocardial infarction, which we commonly called as a heart attack.
Heart attack, yes.
and ejection fraction, that means how much the heart pumps, was only 20%, 10% or 50%. And that's very low. Normal should be around 60. And he said, let me use this machine that I've given these NASA scientists on myself.
Okay.
He said, why not use this machine on myself and get my cardiac status better? So, and they would refuse to let him use it. He said, I want to go home, I want to go home. And what he did was silently, he kept the machine in his heart, in the area of the heart.
In the area of his heart.
2 areas are there which he kept. And the 4th day, the 3rd day, you're not supposed to go on the 3rd day.
Okay.
He cycled back to his home.
Oh, that's amazing.
And I said, and he said, you want to do a cardiac echo on me, please do it. But it's irrelevant because it cannot be 10%.
Okay.
I will not be cycling to my house.
Yeah.
They did
Obviously,
they took him by this thing and they did a cardiac echo, and it was very high. It had gone up to about 40 to 50%.
Oh my God, that's amazing.
So cell regeneration.
It is absolutely amazing. This
It's really
instrument, the
yes.
pulsar.
I
I can vouch for it myself.
Okay.
Please
tell me
really
your
tell a
personal
story.
experience.
Ma'am, tell us,
And,
ma'am, we're really interested.
A few years ago, I was down with a very severe back problem.
Okay.
Now, in medical terms, it was called a disc extrusion.
Okay.
I mean, most people complain of this
Prolapse there.
slip disc.
Slip
It's
disc,
a very
yes.
common case. Whereas mine was an extrusion. It
Okay.
had completely fallen off.
Oh, okay.
And I went to all the famous neurologists and the orthopedic top brass in town. And all of them were very, very vehemently telling me that there is no way I'm going to get back on my 2 feet again.
Okay.
Except,
Surgery.
I stand a chance, a fair chance, if I undergo a surgery
Surgery.
in the spinal column.
Which is a very
Now, a spinal column surgery is
It's a
a
very
very, very
risky.
tricky thing.
Tricky, risky.
Very, very risky thing. So then I approached my family physician, Dr. CVK, and he told me, oh, don't you worry about it. Let me try. I mean, I'm not giving you too much hope. This has not been tried on the back.
She's one of the first few people to have been benefited by this, and it was an utter
Very
success.
nice.
It was
Utter
so
success.
nice. He just worked on it 24 hours, and
So that
within the first 24 hours there was so much improvement. I could get off the bed.
Oh.
Similarly, the next 24 hours, 48 hours later, I could walk to the bathroom. The next 24 hours, he held